Rebecca the naturopath. Thanks for coming back. I'm still talking about omega-3. If you're still interested in hearing more, there's plenty more to talk about. This video is about endometriosis, the benefits of omega-3 for endo. So if you're watching this, I don't think you're a guy. Well, you may be the husband of a lady who's got endo, but if you are a guy, you won't have this condition, all right? Trust me, you won't have it, unless you've got a uterus. But who knows these days? I mean, everything's possible, isn't it? Guys have babies and all sorts. Anyway, let me read some of the script out to you. Endo is an increasingly common problem for women, affecting as many as 1 in 10. It's a condition involving the reproductive system of females, where the endometrial tissue that should be growing in the normal environment in the uterus grows outside. It could be around the ovary, it could even be in the bowel. It could be in the abdominal area, but it can also create all sorts of scenarios internally, like adhesions and scar tissues and all sorts of pain. So it includes symptoms like painful menstrual cycles, infertility, and as I said, even all sorts of gut problems like constipation or diarrhea or bowel cramping can all come as a result of endo. I found that many women in many cases have suffered, in fact, previously from a yeast infection. Right? I wrote about this extensively in Candida Crusher. One of my female friends, a female doctor friend I've known for many years, I think I wrote in my book, went to a conference in Canada a long time ago, an endometriosis conference, and she said that most of the time it was talking about how to clear up thrush, how to detect yeast infections. She said lots of discussions were about yeast when it came to endo. So there you go. Omega-3 fatty acids play a big role in this condition because remember, they're anti-inflammatory, whereas the omega-6 fatty acids, the seed oils, you'll get these in muesli bars and donuts and snack bars and takeaway foods, and I'd say 3/4 of the processed foods you buy in the supermarket will contain some element of omega-6. So these are pro-inflammatory. The last thing you want with endometriosis is to have a diet that could potentially add to the inflammation. When you've got a fire, you don't want to keep putting gasoline on it, okay? You want to put something on it to cool it down and put it out. You don't want to keep making it bigger. So in this case, the omega-6 will make the fire inflammation bigger and the omega-3 will reduce it. So it does make sense. So the omega-3, we've talked about that. Some studies have found omega-3 fatty acids may even help to discourage the implantation and development of endometrial cells. In vivo studies, so these were test tube, found that high omega-3 to 6 ratios inhibit endometrial cell survival. So the women who eat the highest amounts of omega-3 in their diet tend to have the less hassles with the endo cells growing and multiplying. Studies published in 2010 entitled A Prospective Study of Dietary Fat Consumption and Endometriosis Risk found that women who consumed the highest amount of omega-3 essential fatty acids were more than 22% less likely to develop endometriosis in comparison to women who consumed the smallest amounts. Right? So I've long recommended for people with dysmenorrhea, and dysmenorrhea is painful periods, is to take 1,000 milligrams, take 2 of those capsules twice per day, so 4,000 per day for painful period. They work best with taken with magnesium and B complex. So B6 works very well with endo. Other Bs work well. So vitamin B, B5 and B6 are probably my favorites with endometriosis, but I would recommend a B complex tablet or capsule. I recommend 4,000 milligrams of fish oil per day and around 1,500 milligrams of magnesium per day. Sorry about that. But better advice is to also increase your intake of fatty fish like anchovies or sardines or things like that. Right? What else can I say? That's it. Thanks for tuning in.